this is how our denture looks. We've cut off the back to make sure that we can seat it appropriately. When I go into the mouth, I'm basically going to place it over those caps, and I'm looking basically to make sure that I'm seated on the palate all the way, and then I'm not binding basically the denture extension somewhere over here. So we look like we're pretty good. I'll take a mouth mirror, and what I'm going to do is basically bring it back here and verify that my soft palate is on the denture, so I'm basically seated all the way in the denture. So then the next thing I'm going to do is, typically if we didn't have the patient intubated, we would have a dot on the nose and the chin, and that's going to help us to verify that we have the right vertical. But I can kind of wing it here and verify that we're in a good spot. Now if she closes down right now, she's closing basically directly into our denture in the position that we want her to be in. So that's pretty good. So let's see it. If anybody can see, basically she's biting directly into the position where we want her to be with her palate seated. So we know we're at least in the general ballpark and it's looking good. So what we're going to start out with is placing a little bit of, there we go, of the blue mousse into the trough. So this is exactly what we did with our conversion kits yesterday. So I'll seat this down. I'll take her lower jaw. I'll basically put her into the position of where we want to be. And she's not going to be directly in her CR position, but she's pretty close. And she basically hinges right there. So she's doing pretty good.
15 seconds.
Try and clean her up a little bit. I have a tendency to get people very messy. Yeah, I'll show you. If I didn't have lower teeth, we're going to take this out. And when we take this out, if you can see down here, where are we? Okay. If you look at these spots, it gives us direct vision of where we need to go. So what Frank Charles is going to do is he'll go down the axis of these little orientation holes, and he'll drill holes through the denture. The holes I want him to drill through the denture are just going to be tiny punch holes. I don't want him to open up the denture all the way because I want us to be able to see where those are oriented before we start to make big holes. If you make huge holes in the denture, you're going to end up with Swiss cheese denture. You have holes here, holes there, holes everywhere, and then all of a sudden your denture falls apart. So that's not what we want. So I'm going to hand this to Frank Charles. But before I do that, let me show you what I would do if we did not have lower teeth. So she's going to open up. We have no lower teeth. So I'm basically on top of her, and I'm looking at the midline here. I'm looking at the occlusal plane to make sure we're sort of in the right occlusal plane. And then I'm basically just going to pick it up like this, irrespective of what's going on with the lower teeth. So it's all about the orientation of the occlusal plane and the maxillary teeth. And in general, she's going to actually have a very nice display. Once this comes out of her nose, her lip will kind of come back down and it'll look like. Okay? So if we look at the position of the holes, we know that we're in the ballpark. So now that I know that we're in the ballpark, I'm going to ask FC, to open up these holes a little bit more. And while we're doing that, we're going to make our impression of the upper. We're going to do an open tray impression right now today because we have some time. If the patient was not feeling very well, we would do a closed tray impression. And we will go ahead and we're going to loop those. The first thing we need to do is remove the caps. So if we have a hand driver, there we go. Maybe a shorter one. Do we have a shorty? There we go. Okay, so when I'm removing these caps, it's hard to see my fingers here, but what I'm going to do is I'll show you on the front cap. I'm basically going to engage the little area here, and typically I'm going to spin it out, and oftentimes I'm keeping my other fingers on top of it. I'm trying to let you guys see this, but I'm treating it all as one unit. So that all comes out, and I'll take them all out simultaneously. So these are coming off here. And I'll try, like I said, to kind of keep my fingers out of the way, but unfortunately, Dr. Sharafi has the advantage when he's doing surgery. Okay, so caps are off. Now we're going to start to put our impression copings in. These are what we used yesterday, the open tray impression coping. You can see our little Christmas tree. You're going to load it like that with the long pin. Basically, I'm going to go way back in the mouth and find where my multi-unit is. I kind of jiggle it into place, and then typically you can start to spin the whole thing, or just get your fingers on top and start to spin it down. And you'll feel when it kind of goes and engages in place.
Hey, Dr. Ferrier,
Yeah.
why did you switch from open or closed tray to open tray?
We would do a closed tray if the patient was having some problems, but if we can do an open tray now, it's going to be a little bit more accurate.
Yeah.
And the more accurate it is at this time, the more accurate everything else is down the line. So if I have my druthers, I'm always going to do an open tray impression at this time. And we're going to show you kind of how we link the open tray pieces, or I'm sorry, the impression copings when we do it. And if you can appreciate the angulation, it's not 100% in line, so you're always going to have distortion when you pour up that cast if it's not exactly in line. Okay, so now what we're going to do is we take these little sticks and basically measure them up, and we're going to make sure that we can sort of lute them together. So this is sort of equivalent to doing a jig-luted impression like your final impression. Same concept, just different application. So typically I'll have a stick between each one, but in this case, let's see if we can get some pickups here. So typically the way we'll do this is we'll have an assistant or somebody hold this, but it's okay, I'm going to just do it with my fingers here. And you're going to put some, just flowable composite is fine. And we're just going to kind of tweak that in place, so you just cure that. Give it a go there. And we'll just do it for a short period of time. And we're going to do the same thing here.
Yeah. Are you trying to make a statement here?
I thought you were just doing it for this. I didn't know you were doing it for the tray.
Okay. And then just kind of add a little more, make sure we're fairly stable. Yeah. Yeah, you can use, sometimes we use old burrs, you know, it's kind of whatever is around and available for you.
Floss.
Yeah, I use floss sometimes, and I'll basically get that. So you can use all kinds of stuff.
Just like in
Duralay sometimes to root it together, but in general, composite's a little bit faster than Duralay. And once again, this impression is not the end-all, be-all, 100% impression. We're not using this for our final impression. We're just using this for our model here. So you want to just tack that on. Okay, so once again, this is a luxury. This is not something we do all the time, but if I can do it, I will do it. And then we have a tray here that Frank Charles has prepared for us. So what we're going to do is have our patient open.
Try it with the denture.
And basically fit our tray in. We have access to all the screws. Everything looks good. So we're going to go ahead and make our impression now. A jig-luted surgical impression that we're going to make. And what I'm going to do whenever I make this impression or my final impression, I'm going to actually syringe material underneath this pseudo bar, if you will. And then we'll have material on the tray and kind of squish them together. Oftentimes heavy body's not going to flow in here very well if you don't actually syringe it in place. Yeah, so this is the heavy body impression material. It has a small tip, so I can basically load under here, and it's going to be fast set material.
Go ahead and bleed it first, doctor, because it's burning.
What's that?
Bleed it first.
Yeah, yeah. Apparently are using the retractor is a little less practice than our surgical colleagues.
Should
Okay.
we, should we
There
try putting the tray in, see if it'll make sure it'll go around that retractor, or
Well, the wax is on there now.
no? Okay.
Let's just give it a go.
All right.
Bleed it.
Yeah, I'll just blame it on you if it
Okay.
doesn't work, I think. 'Cause-
I'll take that blame.
Yeah, that's how the plan will be. Yep. Pink is the color. I'm gonna wrap it around the base here, try and get on the lingual as much as I can here. And the idea is just to fill that area out. Okay, so now we have our tray here. I'm gonna pull down her lower jaw and we'll insert the tray. Make sure that it's seated all the way down. You can pull out the retractor now. Great.
I love that.
We'll get them.
I'm ordering that tomorrow.
Are they poking through there?
We're trying to find something through here. We got one, two.
So there you go.
Yep. Okay, so if you can see,
Five,
we have 5 little areas poking out here. The 5th one's kind of right in here. It's sort of hard to tell. So I'm just kind of rubbing this wax in here, making sure that they're poking through. So now we're going to hold this for the amount of time. I think this is a fast set, heavy body.
2 minutes to do that.
So getting all the wax out there, all the impression material, etc. Flinging it out of here. Yeah, so like I was saying, this is the sort of luxury part. This is the part we want to do. We want to make an impression, but we're either going to make a closed tray impression or we'll make an open tray impression. Both impressions are fine. The whole reason for the impression is to save us time later on. So this probably is going to take us about 10 minutes to get this impression. But if I take this impression, it will save me along the line 3 to 4 appointments in my office. So if you think about the time that you're going to save overall, this is definitely going to be a time saver over the full process of what we're doing with our patient. So that's why I do it this way. And once again, if the patient is stable and we have the time, I'm going to do the most accurate impression I can. Frank Charles has plenty of experience with not accurate impressions, and then it's more difficult for us.
Nice catch.
Yeah, good catch. It's actually more difficult for us to then do the denture later on. So let's see if we can fit in here. And sometimes while deeply sedated, it's difficult to get the patient to open super wide. But we're basically there. Okay, so we've unscrewed everything. This is basically what your impression looks like when you're done. You can see all the tissues. I'll have the lab technician usually just kind of flatten these areas, because then my underside of my denture is going to be flat as well. There's a little bit of blue mousse here. This will actually help us to hold it in the mouth if there's lots of bone reduction. So sometimes I'll leave the blue mousse in here if it's stabilizing the denture in the mouth. So I'm just going to try it in here real quick. Make sure that my patient, once again, is sort of hinging into that same position. I'm feeling pretty good about that. Looking at my occlusal plane, that's looking pretty good. So I'm feeling like we're in a good spot. If that's the case, now we're going to go ahead and put on our temp cylinders. Okay, so basically we're going to deliver this in the mouth. You can see how we have that little rubber dam square. We're going to place it over the multi-unit abutment. And we're making sure it's seated, and then we're going to tighten it all the way. And you notice I have 2 hands on all the components at any one time. So that one is good. Let me just verify it. So I'm good there. Thank you. Okay, almost here. Okay, now once I have all these seated, I'm going to take an Explorer, I'm going to look underneath, and if you can see this, it's not easy to see, I'll do it on the anterior one. I'm just feeling underneath here to verify there's no gap. So this might be slightly subgingival. I'm just feeling it down here, we're clear. feeling down here. Nothing's trapped or impinging. Go over to this one. Feeling right here. That seems pretty good as well. Make sure we're not encroaching on the tissue or caught there. Yeah, that's good. And then over here, we're clean. So everything is seated all the way down, so we're looking pretty good. And now I'm going to kind of take these rubber dam squares and kind of just push them down so they're not floating so much. If there's too much material in between, you can just cut it off. But in our case, we were able to just kind of squeeze it down, so we're good to go. Okay, so now we have our little rubber dam pieces and we have our cylinders. So at this point on the cylinders, we're either going to pack wax or Teflon tape. Do we have some Teflon tape?
Here's. Go ahead and toss that on.
You just drop it here. Okay. So typically Teflon tape is going to be something like this. You start with a huge roll like this long, and then it actually comes down to something like this level. So we're just going to kind of pack it into the hole. And this is like Teflon tape that we're packing in. It doesn't really matter. It could be cotton, it could be just wax, it could be whatever you want. Should be a condenser in there somewhere. We got perfect. I know, what's a condenser? Yep, it's like a plugger. Yep. Yeah, you want one of those? Makes it pretty easy to stick these things into their holes, right? Okay, so now that I have that plugged in, oftentimes I'll just finish it off with a tiny bit of wax, just to kind of feel that access, be comfortable that we're kind of closing all that off. And you're going to try and get as little of this on the actual cylinder as possible. So you want it on the top, but not around the sides where we're trying to actually engage. Okay, so now I'll take some instrument, I'll clean off around here. Okay, so we have this in place. Now what I'm going to do is take the denture and see if I can seat it through these holes. Now if we did everything perfectly, which we probably did not, it might just seat all the way down. So now if I look, it's binding in certain areas. So I have to take my mirror, my hand mirror. Okay, so what I'm doing, and you're not going to be able to see this on the screen, is basically I'm trying to seat it as well as I can. And I'm taking the hand mirror and I'm looking at each hole and trying to figure out where I need to go. So after this, I'll take a Sharpie, if you can hold that. And if I can look one more time. Okay, so I know this part needs to go a little bit more buccal into this area. So I'm basically just going to widen these holes. So I'm going to make those a little bit bigger. And I think this one just needs to go posterior slightly.
You want to just hold that?
So that's kind of what it's going to look like. So I'll send that back to the laboratory and they're going to open it up. So in our pickup, if you see here, we're actually cutting a hole straight through to make sure we allow to pick it up. And then what we'll do is just fill that with composite once we've got to finish everything up. So we're going to go back in here.
Well, I have to do the bonnet just to do it.
Okay, good. So now I feel like we're seated on the pallet all the way. Everything looks good. I'm going to have her basically close down into that position where we were. That feels comfortable. I like where we are here. So we're going to go ahead and do our pickup now. You can see we've syringed them into smaller syringes, so it's much easier for us to basically load down the channels. We have our adhesive on. We are ready to go. So what we're going to do is have the patient open. Yeah, there we go. Stick this in with as little blood or saliva as is possible. I'm going to have the patient open and my assistant or someone will hold the lower jaw down a little bit. Yeah, those are preloaded, and you can talk to Allure because they do it. So now what I'm doing is basically loading around the channel. It's a little bit hard to see here, but you go straight down into the channel and you load it all the way down into the depth basically till you hit that rubber dam. And you'll see material kind of flowing out of the hole once you get there. I'll try and get an angle where we can actually see that in a moment here. Okay, people can see it, that's great. Now we good. Okay, so I'm going to fill it up very liberally here. Okay, so if you can see around there, you basically have everything kind of covered. And we're going to take 3M hard secure. Yeah, it might be secure hard. I can never remember which way it goes.
We're gonna put the box in front of the camera.
There'll be a box in front of the camera in a moment here.
FC, you have to buy that straight from 3M, right?
So now what we're doing is basically we want the patient to hinge down and we want her to close into the denture. So basically if I look at this, I'm reviewing my occlusal plane, that looks pretty good. I look at the midline, we're basically right in the midline that I want it to be, and we're kind of set in terms of where we are. So I can have the patient kind of close and open into this position. You'll see that there's some acrylic that's sort of floating around there. And there's a little hitch in our getup when she closes down, but once we actually remove that on our cylinder, we should be just fine.
7 minutes.
Okay. Yes, but 3M secure. Yeah, you can just get refills that are less expensive. Okay, so I'm holding the denture with my left hand. I'm verifying that she kind of goes into this position over and over again. Now I'm going to open her up, and we're going to clean off the top once again. So either we have a brush, or we just use something to verify that we're cleaning everything up. We'll clean off her tongue a little bit because there's some extra stuff there. We're cleaning off each top of the cylinder, just making sure we don't have a whole lot of material there. And then I'm going to sort of swipe in here just to make sure we get some of the excess stuff that's coming off. It's 8 minutes total working time. There's basically a set time of 4 minutes after you get your working time going. So we are here. I'm just verifying that I can get my denture with my left hand kind of into the right position. I'm keeping that midline aligned with where we want to be.
5 minutes and 30 seconds left.
Okay, so we have 5 minutes and 30 seconds left. And we're going to open and kind of close, make sure she goes into that spot. And once we're comfortable that the cylinders are clear, and she's kind of hinging into the same spot over and over again, that's when we're going to go ahead and hold her in place. So once more, kind of clean off her tongue a little bit there. Clean off each of these cylinders.
5 minutes to go.
Okay, we're at 5 minutes, so I'm going to kind of get her into the position where I'm comfortable with the denture. Okay. Make sure I like the midline. Good there. And once we get to 4 minutes, then I'm going to hold her in place like this pretty firmly. So I'm basically just going to hold it, and I don't want it to move at all. While it's setting for 4 minutes, you really, really want this to be very stable. Okay, so now we're basically going to remove the wax over the holes. Sometimes you have like a little acrylic shell. You just got to bust that off. Wax can be very messy if you put it all the way down the channel, but if you just have a little bit of it, it oftentimes will come out, and you can see the Teflon tape kind of comes out all as one piece, which is nice. So you know that you're kind of clear down that access channel.
When you pull the tape out, it kind of cleans out the wax out of it.
Yeah, exactly. The tape itself. Clean that out.
Nice.
So here we go. Thank you. Yeah. Okay, so we've relieved all of our screws. We were lucky enough that we didn't get stuff stuck like yesterday. You pull it out and that's kind of how it's going to look. So basically we didn't have anything flow underneath the flap. All of these are ready to go. There's no impression material. And then basically our healing caps are going to go right on top. So now I'm going to take this and I'll hand it to Frank Charles and he's going to do the rest of the conversion for us. So we're going to go ahead and put these on.
After the last 18.
And at this point in time, we're going to wake up the patient. Now, we're probably going to have slight occlusal adjustments that we have to do, but I don't think it should be too major for us. I could feel that there was like a little click, so I don't feel like I was 100% in the right CR position, but I think we're going to be able to adjust it.
Show the impression.
Yeah, let's show the impression. Okay. Hold on one second, let me just put that on and then. Okay, so here's the impression that we have. It's all poured up and ready to go. It's a nice impression, and that's going to give us.
Everything out. See everything has been smoothed out.
What's that? Okay, so if we look at the prosthesis here, yeah, you can see the underside of the intaglio is very, very polished and very nice. It's pretty flat here, so this is exactly what we want. We're going to remove all of our healing caps first. And I'm going to remove it with 2 fingers, so I have basically the driver and then my 2 fingers holding it, all as one unit. Take it out. Kylie, you doing okay?
Mm-hmm.
Okay, so our healing caps are out. We're going to load 1 screw into the prosthesis. Are we on there?
The camera's on, it's just that the monitor shuts off.
Can you give me one on a longer drive? So typically when I deliver the screws, I'm going to try and deliver an anterior screw and posterior screws, make sure I can kind of get everything seated. I'm not torquing it all the way down yet. I'm just basically hand tightening it. Okay. So all these screws are engaging very passively. We're not. Okay, so we basically have all the screws. Now I'm going to basically hand tighten them all the way here. Nice and tight. And we're good to go. So now I'm going to go ahead and tighten it with a torque wrench. Yeah, I can hear you. What's up? Yeah. I can get 12. 14 maybe. Yeah, you have to make sure you're looking on this to verify that you're at 15. If you're not at 15, you're going to break them. Okay, so now she has her teeth in place. If you close down a little bit, it's pretty much in the right set. Close down again. Good.
15.
Of course, yeah, 15.
Yeah, Mark, I think we're okay. We're got like one thing left to do. And
Does it feel okay when you're biting down? Feels a little weird? Okay. But, smile for me? Good. Look at your teeth now, huh?
yeah.
All these use.
That's right. Open? Yeah. So you can see, you can also see that basically when she's closing down, she's in that same biting position that we had before. So you can see I'm going to pack these holes. Oh, is it still on in there? It's still on in there, right?
Yeah. Yes.
Sometimes you can use a driver just to stick that stuff in there. Now what we're using is TeethXpress. This is a temporary material. I like using this. Everyone look away. Okay? We all done?
Yeah,
Yeah. Do we have a mirror? See in your teeth. Did I get a picture? I don't even know if I got a picture of that.
Well, I don't want a
That's
picture.
okay.
I'll take one.
But you're looking good.
Okay,
Teeth are
good.
beautiful.
Good.
Okay? All right.
Awesome.